Have you ever felt a small painless lump in the breast and immediately started worrying about cancer? Don't panic just yet. It might be something far more common and usually harmless called fibroadenoma. Hello friends, welcome back to Medical Study 19, the channel where we simplify complex medical topics into easy to understand lessons for student and health enthusiasts. Today, let's break down everything you need to know about fibroadenoma, its causes, symptoms, diagnosis, and treatment option. What actually a fibroadenoma is? A fibroadenoma is a benign or non-cancerous breast tumor, unlike a breast cancer, which grows larger over time and can spread to other organs. A fibroadenoma remains in the breast tissue. Presently, it is considered as a hyperplasia of a single lobule of breast. Commonly, fibroadenoma is seen in young age group of 15 to 25 years. It is the most common benign tumor of the breast below 30 years of age in female. It is aberration in normal development of lobule. It shows similar hormonal activities of normal breast like lactation and perimenopausal involution. Incidence is 15% of palpable breast lump. It is a bilateral in 20% of the cases and 20% are multiple. Juvenile fibroadenoma occurs in adolescent girl and complex fibroadenoma is condition with fibrocystic changes like a cyst. And 30% of fibroadenoma disappear in size within 2 to 4 years. 10 to 15% will increase in size progressively. It does not occur after menopause unless there is external hormone intake. Fibroadenoma does not turn into malignancy. Now, types or classification, gross classification. It includes three types: soft, hard, and soft. Common after 30 years, more cellular, often bilateral. Hard, common below 30 years and more fibrous. Gent means more than 5 cm in size and common in African regions. Microscopic classification. Intracanalicular means large and soft, mainly cellular stroma with distorted duct, and pericanalicular, small and hard, mainly fibrous stroma with normal duct. And now, what are the clinical features of fibroadenoma? It is present as a painless swelling in one of the quadrants. It is smooth, firm, non-tender, well localized, moves freely within the breast tissue. Hence, it is also known as mouse in breast. Axillary lymph nodes are not seen. Investigations. Mammography. While localized smooth irregular shadow, it may show popcorn calcification, like as you can see in the figure here. FNAC or core biopsy. You can also do ultrasound to confirm solid nature, well defined with smooth outline. And you can also perform MRI if needed. Now, what is the treatment of fibroadenoma? Excision through a circumareolar, also known as Webster's, or submammillary incision, also known as Gaillard-Thomas incision, is done under the general anesthesia. You can see circumareolar is here, and submammillary incision is here. For the purpose of cosmetic, these two types of incision, these two types of surgical excision are practiced. Fibroadenoma which is small or less than 3 centimeter, and the age of the female is less than 30 years, can be left alone with regular flow of with USC at 6 months interval. However, anxiousness of patients and parents make this conservative management very difficult. Now, what are the indications for surgery in fibroadenoma? If the size is more than 3 centimeter, if there are multiple fibroadenoma, and the fibroadenoma is joint type, and there is a recurrence, and for the osmosis purpose, the surgical is done. Thank you. So, to conclude, fibroadenoma is a benign breast lump most commonly found in young women, and it usually does not increase cancer risk. Diagnosis is made through clinical exam, ultrasound, and biopsy mammography, as I have already told. Treatment can vary from simple observation to surgical removal in selective cases. The key message is don't panic. If you feel a lump, but always consult a doctor for proper evaluation. If you found this video helpful, do give it a thumb up, share it with your friends, and subscribe to Medical 19 for more easy and practical medical explanation. See you in the next video. Thank you.